So hello everyone. My name is Reagan Johnson and I am joined by my colleague Kara Foster. We are project coordinators here at CityMatCH and we would like to welcome all of you to the first CityMatCH Learning Network Call of the Year. We are so happy that all of you have joined us. To start today's webinar, I wanted to briefly go over a few housekeeping items that will help this webinar run smoothly. For the duration of today's webinar, we ask that you keep your phone lines muted to help eliminate any background noise that may make it hard for others to hear today's presentation. To mute your phone line, press *6 on your phone keypad. As questions and/or comments arise during today's presentation, please leave them in the webinar chat box. Due to the large number of webinar participants, we plan to facilitate the discussion time by calling on those that ask questions in the chat box. When it comes time for Q&A, we will let you know when to unmute your individual phone line to ask your question. For future reference, you can unmute your phone line by pressing *7 on your phone keypad. Lastly, if you experience any technical difficulties during this webinar, please call ReadyTalk Customer Care. The phone number is listed on this slide. I will give everyone just a minute to jot down this number for future reference. So again, welcome to today's webinar on reproductive justice. This CityMatCH Learning Network webinar is hosted by the newest CityMatCH Action Group, the Reproductive Justice AdHoc Group. Here at CityMatCH, Kara and I serve as the project co-leads for this new action group. To start today's webinar, I'd like to introduce the two CityMatCH board members who serve as the leadership for this ad hoc group. I would like to introduce Kiko, who is the Director of the Family Health Services Division at the Alameda County Public Health Department, and Deb Kaplan, who is the Assistant Commissioner of the Bureau of Maternal, Infant, and Reproductive Health at the New York City Department of Health and Mental Hygiene. I will now turn it over to Kiko and Deb, who will introduce today's speakers.
So good afternoon or good morning, everyone, depending on where you are in this country. This is Kiko from Oakland, California. I'm really happy to be here today. Before I introduce the speaker, I just want to give a little promo for our Reproductive Justice Ad Hoc Group, which, as Reagan mentioned, is a new group, newly formed, and I think particularly timely and important in light of what's happening in our country and the new administration. I think all of you probably heard about President Trump cutting funding to international organizations that provide abortion or education about abortion. So this is the road that we're on, and the work that we're doing and coming together in solidarity for women's rights and reproductive rights is more important than ever. So I thank all of you for being on the call today and really urge you to get involved with this ad hoc work group. If you're interested, you can send an email to any of us after the call, or there might be more information about how to get involved. So that said, without further ado, I'm really pleased and honored to be able to introduce Monica Ray Simpson. She is the Executive Director of Sister Song Women of Color Reproductive Justice Collective. She's a native of rural North Carolina and has organized extensively against human rights violations, reproductive oppression, the prison industrial complex, racism, and intolerance, and is deeply invested in Southern movement building and the fight for Black liberation. So someone that we really need to hear from today. She's also committed to birth justice as a certified doula. And she couples her activism with her artistry and released her first live album entitled Revolutionary Love, where she blends her gospel roots and her passion for social justice with deep soul to create the sound known as Revolutionary Soul. Because of her artivism, Monica was named as a new civil rights leader by Essence magazine and chosen as one of Advocate magazine's 40 under 40 leaders. So please join me in welcoming and listening to Monica Ray Simpson today. Monica.
Hello, everyone. It's such an honor to call with you, and I'm very excited to do this call with a person I admire so much and definitely continue to learn from daily, Dr. Lynn Roberts. So I think that Lynn and I are going to kind of do this together. So Lynn, are you with?
Hi.
Yes.
Excuse me, Monica. This is Deb Kaplan.
Hi.
Are you able to hear me? It's Deb Kaplan.
Absolutely.
Before you jump in, I wanted to also introduce Lynn, and then both of you can join in together.
Okay, perfect.
So I'm going to do that first, and it is my pleasure. This is Deb Kaplan, and it is my pleasure and honor to introduce Dr. Lynn Roberts. Dr. Roberts has a BS in Human Development from Howard University and a PhD in Human Services Studies from Cornell University. She's an assistant professor in the Community Health and Social Sciences program of the City University of New York Graduate School of Public Health and Health Policy. And prior to City University of New York, Dr. Roberts oversaw the development, implementation, and evaluation of several programs for women and youth in New York City. She also served on the board of Sister Song Women of Color Reproductive Justice Collective from 2002 to 2012 and has co-edited the forthcoming anthology on reproductive justice, which will be coming out through Feminist Press in January of 2018. Dr. Roberts' current activism and scholarship examine the intersections of race, class, and gender in adolescent dating relationships, juvenile justice, and reproductive health policies, as well as the impact of models of collaborative inquiry and teaching on civic and political engagement. She's honored to be the mother of 4 amazing human beings and is in constant awe of her 4 grandchildren. And I want to add that I have the pleasure of knowing Dr. Roberts in both my academic and professional life and collaborating with her directly. Most recently, we've been working together as part of the New York City Department of Health and Mental Hygiene's efforts to incorporate a reproductive justice lens into our sexual and reproductive health work. And I'm just going to take a moment to tell the listeners about it before turning over the program to Dr. Roberts and Monica Simpson. This has been part of an exciting collaboration between the New York City Health Department and an engaged group of community-based organizations serving the vast communities of New York City to address the gross inequities in the sexual and reproductive health of New Yorkers. And our work around the RJ framework, which we have built on based on what you'll learn today and really the history of the development of this framework, which you will be hearing about very shortly. We expanded that to become sexual and reproductive justice to more specifically address these forms of oppression not limited to reproduction. And it fits perfectly with our mission to undo injustice under the leadership of our Commissioner, Dr. Mary Bassett, where naming and addressing health inequities and racism frame all that we do. The Sexual and Reproductive Justice Community Engagement Group in New York City, or the CEG, is currently comprised of individuals representing over 57 community-based organizations throughout New York City. It represents a novel way of government engaging with community to develop public awareness campaigns and is based on shared leadership, meaning that we share how we make decisions. And I have to say we are learning as we go and learning more and more each day about how to do this work. We've developed a short video on sexual and reproductive justice and have plans to develop a discussion guide for the video. And you can learn more about what we're doing in New York City and watch our video by visiting newyorkcity.gov and searching SRJ. And now, without further ado, I'm delighted to turn the program over to Monica Simpson and Dr. Lynn Roberts. Thank you.
Hello, everyone. And thank you to Kiko and Deb for those wonderful introductions. So I'm going to get us started, and Monica and I are going to, switch back and forth a little bit to make it more interesting, and also to speak to our different orientations to the RJ framework. So I'm going to begin with a little bit of the history and how this framework has evolved. So back in 1994, a group of Black women gathered in Chicago, Illinois, to discuss the health of women of color. They had just attended the International Conference on Population and Development in Cairo, Egypt, where global activists agreed that reproductive rights are essential to social justice. Inspired by Cairo and also in response to the Clinton administration's push for healthcare reform, this gathering of Black women in Chicago discussed the multiple ways that reproductive rights were jeopardized by domestic policies, or lack thereof. After much organizing, this group named themselves Women of African Descent for Reproductive Justice, and thus the term reproductive justice was born. It would not be until 2003, at a conference convened by Sister Song, that reproductive justice would become widely used as an organizing framework on behalf of all Indigenous and women of color who were impacted by sexual and reproductive oppression. From its inception, the reproductive justice framework has utilized an intersectional analysis based on internationally accepted human rights doctrine and the practice of self-help and community care. And we will elaborate on each of these elements in just a moment. Next slide, please. First, I'd like to talk about what is reproductive oppression, or as Deb referred to, both sexual and reproductive oppression, which can be defined as the control and exploitation of cis and trans women and girls and other marginalized individuals through our bodies, sexuality, labor, and reproduction. And just as in many other parts of the world, reproductive politics in the U.S. is based on gendered, sexualized, and racialized systems of dominance that inform and become concretized in public policies with harmful consequences for cis, trans women and girls. It is this regulation of gendered bodies of color that becomes a powerful and strategic pathway for controlling and imperiling entire communities. These structures can also be based on class, on ability, on immigration status or health status, and many other social statuses. Next slide, please. Here are just some of the examples of sexual and reproductive oppression visited upon Indigenous and women of color throughout our shared history in the United States and up until the present. In addition to the exploitation of their labor, enslaved women of African descent were forced to breed only to have their children sold as chattel during slavery. And it is well documented that between 1845 to 1849, the founder of modern gynecology, J. Marion Sims, experimented on enslaved African women and their infants without any anesthesia to perfect surgical procedures for white women. From the late 1800s until the early 1970s, Indigenous children were removed from their families and sent to boarding schools to, quote-unquote, civilize and remove the Indian from them. There have been numerous cases of sterilization abuse by the U.S. government and medical institutions that specifically targeted Puerto Rican women, both on the island and mainland, African American women and girls in North Carolina, Native American women on reservations, and Mexican American women in California. In the 1950s, Puerto Rican women were aggressively recruited to participate in clinical trials without their informed consent to develop the pill. I'm going to turn it over to Monica to go over some of the more recent examples, if you don't mind, Monica.
Sure, absolutely. I mean, the history, every time I go through this training and I think about the historical references that are here, it amazes me how I get just surprised every time I hear it. But what's even more amazing is that reproductive oppression is still very real and still very much something that we are working to combat every single day. And so some of those more recent experiences of reproductive oppression centers around limits on comprehensive sex education in schools. As we know, most schools, we're based here, we're a Southern-based national organization, so much of what we deal with here at Sister Song is dealing with a lot of school systems that are still abstinence-based and abstinence-only education programs for young students, and we know that those programs are not working. They're not helping, young people be able to make the decisions that they need to for themselves in a very informed way. So if you're not giving people, especially young people in this instance, access to the information that they need to be able to make the best decisions for themselves, and that is very much an example of reproductive oppression. When we think about coercive use of contraceptives, this has a little bit of a historic backdrop to it when we think about the long, very long, history of like Depo and other, forms of contraceptives that have been used primarily on communities of color and really pushed heavily on communities of color. And we are definitely still dealing with that today. One of the things that Sister Song, in partnership with the National Women's Health Network, has been working to address is a principled approach to LARC implementation, right? So it's not that we want to ever take away an option for anyone to be able to choose a method that would prevent them from having a pregnancy, but it's about how are we making sure that we're not dipping our toes back into historical trauma in our communities. And how then can we make sure that the implementation of these contraceptives are ones that, are rooted in the reproductive justice principles and centers the most marginalized communities. So we did a project with the National Women's Health Network to ask, different service providers and, establishments to sign on, to what we call the principled approach to dealing with contraceptives. Restrictions on abortion. This is something that we see every single day, unfortunately. It's something that we see with this administration now, with them re-administering the gag rule, and so many things that we see from a state-based level to a federal level where abortion access is continuing to be restricted, and in some places almost non-existent when we think about Mississippi only having access to one abortion clinic in the entire state. That also includes trap laws and other pieces of legislation that are put in place to even add more barriers to access. Another recent example of reproductive oppression, discriminatory, early termination of parental rights. That's huge, right? And then also demonization and criminalization of pregnant women or parenting women based on age, substance abuse, being poor, and et cetera. So we saw this really show up a lot in Tennessee, as they were a state that they were pushing very heavily on, criminalizing women who were, dealing with substance abuse issues. And instead of, trying to find ways to offer care and support, criminalization was also put in place. So, and one thing that's not on this list, but something that Sister Song has really been taking a very firm stance on, is looking at how police brutality is directly linked to reproductive oppression when we think about the loss of so many young children at the hands of police, as well as, losing women and men, right, at the hands of police, is definitely reproductive injustice, and it's a form of oppression where we see like this control and exploitation and of our bodies and our communities. So again, those are some of the more recent examples, and I'll stop there.
Thank you, Monica. Next slide, please. So in response to all these examples of reproductive oppression, reproductive justice is the unequivocal mobilized resistance to this reproductive oppression. One of the founding member organizations of Sister Song, now known as Forward Together, defined reproductive justice as the complete physical, mental, spiritual, political, economic, and social well-being of women and girls, and will be achieved when women and girls have the economic, social, and political power and resources to make healthy decisions about our bodies, sexuality, and reproduction for ourselves, our families, and our communities in all areas of our lives. Next slide, please. Reproductive justice is just one of three frameworks that have emerged in response to sexual and reproductive oppression. The other two are reproductive health and reproductive rights. All three of these frameworks are critical, and they are not mutually exclusive, but it is important to distinguish them. Next slide, please. These three frameworks are often utilized in concert with each other to achieve reproductive justice and health equity. Whether as public health professionals, advocates, or as community organizers, some of us move in and out of these frameworks in our day-to-day work. It is important to understand which model is guiding and supporting the decisions we make and strategies that we utilize in our work. Unlike the reproductive health service delivery model or the legal advocacy-based model of reproductive rights, the reproductive justice framework informs a social movement dedicated to eradicating sexual and reproductive oppression. Next slide, please. And now I'd like Monica to share with you some of the historical timeline of the reproductive justice framework.
Sure. So a lot of people, they always ask us, so when did this happen? When did it start? And, we have this date of 1994, with the meeting of the black women in Chicago. That's kind of like the date that most people start with. But in actuality, the concept of reproductive justice kind of goes back a little bit further because and what Sister Song really asserts and what we know is a true kind of, foundation for the work of reproductive justice is the human rights analysis. And so for us, this concept, this more intersectional concept of looking at reproductive health and rights in conjunction with social justice issues goes back to actually 1984, where we had that first international meeting on women and health, right? And this is, really where we started to see a lot of the conversations about reproductive health and rights start bubbling up in a way as they actually started to, coexist, right, with what were the real realities that women across the globe were dealing with in their communities. In 1993, there was the Vienna Conference on Human Rights. So we had a deepening of this work in Vienna where, human rights started to really, where women across the globe started to see themselves, see their work in this human rights world. In Cairo, the International Conference on Population and Development was a huge turning point in this conversation because this is really where black women in particular, as they were in attendance, started to see that across the globe, women were able to make this connection between their reproductive health and rights and, again, what was their very lived reality around what was happening in their communities. And so these women came back together and caucused in Illinois in 1994, and they asked themselves, well, what does this look like for us here domestically in the United States of America, especially in 1994 as we were on, we were at the height of healthcare reform under the Clinton administration. And so the questions that they were asking themselves was, how can we use this human rights approach that we see that's working, right, for women across the globe here? And so those women decided to do an action together, and they named themselves Women of African Descent for Reproductive Justice, basically, and they put a call to action in the Washington Post as well as other outlets that encourage black women in particular to sign on to this action where they were demanding that if this Congress, if our legislators, our elected officials were going to talk about health care reform, that they could not do that without centering the most marginalized people and understanding that this conversation around our health needed to also include reproductive health and rights, and that those reproductive health and rights were always influenced by the very lived reality that people faced every single day. So it was a huge turning point for the movement, and we kind of feel like that's really where reproductive justice was birthed, right, was out of, that meeting of black women, but also because of what was happening globally as well as nationally with healthcare reform. In 1995, Beijing had the fourth World Conference for Women. We started to see, again, this conversation continue to move and take shape, and, we started to really make those ties with global women around this work. And the 14th World Congress of Sexology in Hong Kong in 1999 was also another huge turning point because this is actually where we were able to start to talk about the sexual rights part of our work, right? Again, so much of the work around reproductive health and rights was on contraception. It was on, making sure we had access to abortion. It was remaining legal. And very rarely were there, really deep conversations happening around sex itself. So this was one of those kind of international stages where the conversation of sex was centered, right? In 2003, Sister Song had its first national conference on reproductive health and sexual rights. Very soon after that, Sister Song's first national coordinator took co-leadership, that's Loretta Ross, took co-leadership in renaming the March for Women's, the march that was supposed to originally be the March for Choice to the March for Women's Lives. So even with this particular march, which up until this past weekend was the largest march of women, in the United States of America, at 1.2 million folks, that march, again, was originally kind of formulated around choice, right, which is a very powerful framework. And this concept of reproductive justice was not meant to do away with choice, right? It was just expanding the conversation and the analysis. And so because of that, these women of color that were brought into the fold because of Sister Song's leadership, because of Loretta Ross's leadership, really helped to transform the way that the march itself was even named. Right? Because what these women understood was, for a lot of communities of color, the notion of choice is a privilege, right? And so that alone is just totally, causing some people to not feel accepted or even feeling like it's a place they can step into fully. So with the expansion of this march to include women's lives and talking about it from a more holistic perspective, we saw this march transform to the 1.2 million people. So that really speaks to the power of the reproductive justice framework and the power and the expertise of women of color and their leadership. In 2005, the Trust Black Women campaign in resistance to billboards demonizing and accusing black women of their own genocide was formed. So in 2005, we started to see a shift in the way abortion conversation was happening. We started to see racialized attacks on our ability to make our own decisions. And black women were hit the hardest. Here in Georgia, right in our backyard, we had billboards go up that read, "The most dangerous place for an African-American child is in the mother's womb." And these billboards spread all across the country in New York and California, Chicago, just a very hideous campaign that was just shaming black women and accusing them of committing genocide by choosing to have an abortion. And so Sister Song led the charge of bringing black women together who were doing this work to create a campaign that was essentially created to be a united front against any attack on our reproductive freedom. And so this campaign successfully removed those billboards all across the country. It beat back legislation that accompanied some of these billboards, like what happened here in Georgia around sex-selective bans, legislation that started to creep into our legislature. And it really did let these folks know that you're not going to mess with black women. You're actually going to trust us to make our own decisions about our lives and our families. In 2007, in 2011, we had, 2007. Was it 4 or 7? I swear, y'all, this timeline gets so crazy sometimes because so much has happened over the past 20 years. But our Let's Talk About Sex conference, we held our first one in 2007 in Chicago, and we're holding our next one in this October. So this conference, again, was going back to where, this timeline where we had that, convention that happened in Hong Kong around sexology. We can't talk about reproductive justice, reproductive health, or rights without talking about sex, without talking about what that means for us. And so this conference was not just about us wanting to have a fun time. It was about us really being proactive about thinking about what this means for our communities and how do we start to center our voice and our leadership in this conversation. So that's a little bit of the history of what kind of led us to what we now have as the reproductive justice movement.
Thank you, Monica. Next slide, please. And if you don't mind doing us the honors again on
yeah,
the
sure. I'll keep going. So,
reproductive justice.
Yeah. So a lot of people ask us a lot, well, how do you really define what reproductive justice is? They hear reproductive justice and intersectionality. They hear reproductive justice and human rights and, that it's rooted in this black feminist theory. Like all of these are different, pieces of the foundation of the work. But what is it really? Like how do we define this? How would we say this to someone if they asked us what reproductive justice is? And so Sister Song has defined reproductive justice as the human right to one, if and decide that every individual has the human right to one, decide if and when they will have a child and the conditions under which they will give birth or create a family. 2, decide if they will not have a child and their options for preventing or ending a pregnancy. 3, every individual has the human right to parent the child or children that they have and the ones that they already have with the necessary social supports and safe environments and healthy communities and without threat or harm from individuals, organizations, or institutions of the state. And lastly, every individual has the human right to bodily autonomy, free from any form of sexual or reproductive oppression. So for us, we say very simply that reproductive justice is the human right to, one, have a child, to not have a child, to parent those children that we have in healthy and safe environments, and the human right to bodily autonomy. And what's interesting about the evolution even of this definition, right, because up until a couple of years ago, this definition kind of ended with the first three, right, the right to have a child, not have a child, and parent a child. And what we realized is that definition alone made our movement seem very womb-centered, right? What about those folks who cannot have children or do not want to have children? What about our trans brothers and sisters, right, who very much are connected to this work and should be connected to this work? What about those people who see reproduction not just about reproducing a child, but being able to live freely, to reproduce the ideas that they have or their gifts or their analysis, whatever that is? Like, how can we make way to really, talk about the fullness of the lives that each and every individual lives? And so that's why this concept of bodily autonomy for us was extremely important, because if an individual has the ability to self-determine and that their body is not, subjected to sexual or reproductive oppression, then they are able to really live the free life that they need to make their decisions and to reproduce in the ways that feel good for them. But this also very much made it very clear to our LGBTQ family their direct connection to this movement as well. So that's how we define it. You might get a quiz on it later. Again, it's to decide has the human right to decide if they will have a child, if they will not have a child, parent their children in healthy and safe environments, and the human right to bodily autonomy.
Thank you, Monica. As mentioned earlier, there are three key elements of the reproductive justice framework, and we will discuss and describe these in the next few slides. I'll begin with the first. Next slide, please. So the first foundational element of the RJ framework is intersectionality, which is a theoretical model developed by women of color in the 1960s to 1970s to address how oppression based on race, class, and gender affects women of color. The term intersectionality was first coined by critical race scholar Kimberly Crenshaw and later expounded upon by Patricia Hill Collins in her seminal book, Black Feminist Thought, Knowledge, Consciousness, and the Politics of Empowerment. But I will also note that there is a long history of intersectional analysis and organizing that predated that precise use of this term, from Sojourner Truth to Angela Davis, and the concept has since been expanded to recognize ways in which interlocking systems of oppression impact on the bodies, the families, and communities of all those who have been marginalized based on their social identities and statuses. Next slide, please, and Monica will talk about the second key element.
Okay, great. I'm sorry. That me and this mute thing is very funny. The second key element is human rights, right? So based on the body of universally accepted laws upheld by the United Nations, human rights, it asserts that there is an inherent right of individuals to make personal decisions about one's life and the obligation of government and society to ensure that the conditions are suitable for implementing one's decisions. So we, in our larger trainings where we're able to kind of go deeper on this, we really take folks through a really great discussion about like those different categories of human rights. Is that on the next slide, Lynn, or is that we just went to the
No, it's not,
yeah.
But I can review them.
Yes.
They are civil rights, political rights, such as voting, free speech and assembly, economic rights, such as living wage or workers' rights, social rights, the right to health care and food and shelter and education and other social welfare services, cultural rights, freedom of religion and language, environmental rights, access to clean air and water, and to not live in a toxic neighborhood, developmental rights, the right to control our own natural resources. And as we've talked about, sexual rights, which include, according to human rights conventions and declarations and resolutions, the right to have or not have children, the right to marry and when, same-sex rights, transgender rights, right to birth control and abortion, and the right to sexual pleasure and to define our own families.
That might work.
Slide. Yeah, next slide, please.
Okay, I'm sorry. I'm back. I'm just going to stay off. I'm trying to make sure that I'm not in your.
Yeah. So a third element is that of self-care, or to have access to a community of caring. And self-help, which is defined in a variety of ways and with different language, but basically originated with the Black Women's Health Movement in the United States and spread internationally by the National Black Women's Health Project and the National Latina Health Organization. It's also used in the women's health movement at large by HIV/AIDS groups and amongst indigenous and women of color groups throughout the United States. Next slide, please. It can be practiced on an individual, institutional, and community level, and there are different approaches and terminology used to describe it, but the key ingredients are to increase self-awareness about how oppression impacts on our health, to give and receive support from others, to heal from the traumas of oppression, and to take better care of ourselves and each other. And for reproductive justice organizations, this approach is infused within all aspects of our work by building this practice into our interactions and meetings, convenings, and the very structure of our organizations. And Monica, feel free to add anything, because I know you do this in a variety of ways, including through your artivism.
Yeah, absolutely. I think that this is one of the most critical pieces to reproductive justice, and I think it's what makes this movement so transformative, because, you know, so much about activist work and so much about our movement work is about the doing. It's about the fighting. It's about, you know, the pushing back, and, you know, we're always, you know, on the defense so much of the time, and so much of our energy goes outside of us. And a lot of folks get connected to movement work, especially when we think about reproductive justice, because a lot of us have experienced, whether directly or indirectly, right, reproductive oppression. And so in order for, you know, a really wise person told me a very long time ago, a person that actually does a lot of this self-help work herself is like, you know, if you want to be a change agent, right, then what are you willing to change within yourself? How do you look at yourself first? And I think that is I know it was like one of the biggest things that attracted me to this movement's work, because this was not one of those movements where you felt like you had to do that, you know, on the outside, right? It's something that was very much held and centered in how we do this work. And so, again, I think that, you know, for me as an artist and activist, yes, my art, me singing and me being able to, you know, release, you know, in the ways that I need to, I think makes me a stronger leader. And I think that, you know, my art helps to move movement forward, right? But I just think that, again, this piece of the work is what helps to make reproductive justice such a powerful movement, because it's dedicated to building powerful people first.
Wow, absolutely. Thank you for that. Next slide, please. So as we think about the key strategies, some of which we've already touched upon, and Monica's given such rich examples, is that the strategies include focusing on addressing the intersecting oppressions, the intersectionality, which means you have to develop, you know, more holistic ways of analyzing and then addressing the key issues that are impacting on people's lives. Then it requires us to analyze and work to change these unjust systems of power. And I think of Monica testifying before the Democratic Platform Committee last summer. I think of the work that Deb described earlier that we're doing in New York City with the Department of Health to integrate this framework into their work. and guiding them in their efforts to transform to a more inclusive and anti-racist institution. It requires us, or another strategy is to center the marginalized. The most marginalized amongst us, the last should be first approach to everything that we do. And it also involves the support of women of color and indigenous leadership in a variety of ways, through recognizing existing organizations that they lead, and also bringing them into spaces and places where decisions get made with them instead of about them. It's the buildup of a socio-political economic power base, and that's not only through electoral politics, but that's through coalition and building with other allied social justice organizations, and really, as evidenced by this past weekend, sustaining it beyond a single march to how we work at all levels, locally, statewide, and nationally, to bring about the desired changes. And it is, as Monica just described, this radical self-love to heal from oppression. That is one of, and probably one of the most important strategies of reproductive justice. And Monica, is there anything you'd like to add or illuminate things?
No, I think that's good. I think I'm good.
Okay. So with these strategies are a number of challenges. This approach challenges people personally and politically by asking them to adopt a worldview and to take actions that are diametrically opposed to the status quo. And to do that, to take action involves taking risks, including taking direct action against those who abuse power. It also is a challenge that transformational change requires more resources and a lot of staying power. It's tedious work, and as Deb says, we sometimes are figuring it out as we go along, and there aren't always clear roadmaps. But it does require a dedication of resources and commitments, and willing to be in it for the long haul. The potential for this type of radical transformation can actually alarm some and also make cynics of many across the political spectrum. In other words, some may just lose any sense of hope that it's even feasible, so why bother, while others may try to, get in the way, to be, to block actual transformation because they're comfortable with doing things the way we've always done them. And we've also been challenged by the fact that women of color often are engaged in reproductive justice and have always shown up for others, but others do not always show up for us. And when they do, it is often too little and too late, and that can have consequences for the reproductive justice work that we're all trying to achieve. So that's one of the challenges that we continually have to work through. And as Monica mentioned about the framework originally being very womb-centered, focused on reproduction, we have really had to step up to, apply a queer analysis within reproductive justice, because that is central to the liberation of all people. And those are just some of the challenges. I'm sure there's others if we had more time, and each one of these we could elaborate on. And maybe that will come up in our discussion later. Next slide, please. So as I mentioned earlier, the three frameworks of reproductive health, rights, and justice are not mutually exclusive and often must work in concert with each other to achieve reproductive justice and also health equity. And if we look at the definition of health equity espoused by Healthy People 2020, which I can't see fully on my screen here, so hopefully others can, that both reproductive justice and health equity are totally aligned, And the RJ framework is about health equity with a human rights lens and a focus on sexual and reproductive health and well-being. They are complementary, and it can be powerful to utilize the RJ framework to collaborate with communities that are experiencing the most threat and jeopardy. But I do like to distinguish, next slide please, between what we mean by achieving equality versus achieving equity versus achieving justice. So in public health, we are increasingly recognizing that it is not enough for us to achieve equality. To achieve equity, we must compensate by providing for each of us according to our actual needs. So we wouldn't treat everyone equally or ensure that everyone has the same, but some might need to receive more than others to make up for past injustices. But to truly achieve justice, next slide please, we must remove the structural barriers that create unequal and inequitable conditions in the first place. That means tearing down the fence, or as R.G. Lord said, the master's tools will never dismantle the master's house. So what does this mean? Next slide, please. What does tearing down the fence mean when we think of maternal child health? Well, it means reframing maternal and child health in ways that are conducive to a reproductive justice framework. Next slide, please. Some of the ways to do that for maternal child health professionals to do this reframing would require understanding the historical context of the control of indigenous and women of color's reproduction and its consequences on their health, healthcare practice, and research. It would require listening and respecting the self-determination and bodily autonomy of all people, especially the most marginalized. It would involve practicing humility and taking risks toward deeper engagement with those who are most marginalized in our society and who are in our care. It can mean joining and collaborating with organizations and coalitions led by indigenous and women of color and people of color more generally in all their intersectional identities and statuses. It also would require being an informed citizen, a voter, an ally, an advocate, and an agitator, which sometimes requires putting a little more skin in the game, as well as listening and reading and learning as much as possible through indigenous and women of color created media. And then it requires the continual reflection and work to transform your institutional policies and practices that impede reproductive justice. So those are just some ways in which we might think about how to apply a reproductive justice framework in the work that we're doing related to maternal and child health. And now I'd like to turn it back to Monica to just share her specific work on doing reproductive justice work specific to maternal and child health. As you heard from her background, you know, she's just a wealth of experience, but she is on the forefront of leading the way by seizing the opportunities and meeting the challenges of doing reproductive justice work with several partners.
Thank you so much, Lynn. I really appreciated that last slide. That was awesome. So now to take that from theory, so to speak, right, now to practice, and what does this really look like for a project that's looking to center itself as a reproductive justice model of how to look at child maternal health issues through a reproductive justice lens. And so that is what we want to present to you all a little bit today with our Black Mamas Matter work. And so I just want to also credit, to my partner who's working, to our partner, but I count her mine too because I like her so much, Pilar Herrero, who is with us in Reproductive Rights. She helped to create this presentation that we've been able to present to lots of awesome folks who are interested in the work. So I just want to give Pilar all her props for helping us make this visible and visual for us. We can go to the next slide. So Black Mamas Matter. In July of 2014, Sister Song, along with the Center for Reproductive Rights as well as the National Latina Institute for Reproductive Health, created a report entitled Reproductive Injustice, looking at racial and gender discrimination in the U.S. healthcare system. So why did we create this report in 2014? Well, we started to do some research as Sister Song started to center its work and to make a strategic focus in doing a lot more research on our southern spaces that we were in. Like we had been strategically based in the South since the beginning of Sister Song, but so much of our work takes us outside of the South. And so we really wanted to make a deeper investment in Southern movement building, and so we really wanted to take a glance and just really dig deep on what was at stake for us, what was actually happening, with, women of color in the South around reproductive health and rights and justice. And one of the things that came up in our research was that maternal health was actually on the rise. And so for us, of course, we were completely just flabbergasted. Like, what do you mean that, maternal mortality is on the rise in the United States of America? And so we partnered, with our friends at the Center for Reproductive Rights, who was very much looking at the same thing, and we wanted to really get personal stories, personal accounts of, like, what was leading to this issue, right? So not just looking at it from, a public policy perspective or, from the social determinants of health or, from this place that we have a lot of our CDC kind of service provider kind of jargon coming from. We wanted to hear from the people that were most impacted by what was happening. And so we went to the two states where maternal mortality was on the rise, and that was Georgia and Mississippi, and we held focus groups with Black women across the state to ask them about what they had access to in terms of their sexual health. Their comprehensive sex education, did they have that? What did they get? Did they even know about their bodies even before thinking about having a child? We asked them questions about what did their prenatal care look like if they did get pregnant? What did it look like, for them, during pregnancy, after pregnancy? And the stories that we got back were absolutely astonishing. It didn't matter whether the Black woman had the most education. It didn't matter if she made the most money or if she was a low-income person. Overwhelmingly, these women were getting they didn't get access to information. They were being stereotyped as soon as they walked through the door. And they were met with so much racism and shame, especially if they were having multiple children. It was assumed that they just wanted to have children and that they didn't have a birth plan for themselves, or if this was something that they actually wanted. And sometimes when I think back to those stories, I'm still just disheartened that we have a system that's dedicated to, or supposed to be dedicated to, care and health and well-being, and unfortunately, racism is not removed from that system either. It's still very prevalent there. And we were angry, we were sad, we were shocked, but we pulled these stories together and created this report that we then took to the Committee on the Elimination of Racial Discrimination, which is known as the Third Committee, in Geneva, Switzerland. We raised this as an international issue, as a human rights issue, and something that we wanted to be discussed on a global stage, especially as we see maternal mortality as something that is usually something that's dealt with, in countries where there's no access to running water, right? And what's even more astonishing when we think about like this reproductive justice lens, when we were in Geneva presenting this report before the Third Committee, Mike Brown was shot and killed by police. So not only were we there as reproductive justice activists and advocates on behalf of this report in maternal health, we were also in the same room with Trayvon Martin's mom. We were also in the same room with Jordan Davis's mother, right? And so here we are looking at the very thing that reproductive justice asserts, that we can't talk about our reproductive health and rights in this country and not connected to the very, 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 very real realities that so many of our communities, especially communities of color, are facing when it comes to violence and racism and the system of white supremacy that continues, to just hurt and harm our communities. And here we had it right in front of our face. And we're all presenting this to the Committee on the Elimination of Racial Discrimination, which is a global committee. And so the U.S. wasn't looking too pretty, right, in Geneva. They were not very happy about what they were hearing, especially as they were also, talking about the fact that, for us in our report, one of the things that we lifted up was that, we say that we have the Affordable Care Act that was, definitely has expanded, health care to millions more folks. But in the South, Medicaid expansion didn't happen. It's still not happening. So we still have hundreds of thousands, if not millions of folks who are still without access to care. So this helped to raise this issue of maternal mortality really way up there for us, right? And so we knew that not only did we need to make this an issue globally, we needed to make sure that we were thinking about what our strategies were going to be for handling this domestically. So in June of 2015, we had our first Black Mamas Matter convening in Atlanta here at the Mother House, and we brought together service providers, midwives, doulas, activists, political folks, electeds, right? We brought everyone together across these different lines to say this is an issue. How are we going to deal with it? Are you ready to work with us to deal with it? And are we willing to use the reproductive justice framework to address it? And everyone was very much in alignment with that. So from that meeting, we then produced and released the Black Mamas Matter Advocacy Toolkit, and we had our second convening in Atlanta to talk about how we were going to move our communities with this toolkit, which helped us understand the issue. It gave talking points and other ways for us to really address the issue. In November of 2016, the Black Mamas Matter Steering Committee formed and held an organizing retreat in Atlanta, because now we're taking this what started as just like an issue-based kind of campaign to a national campaign where we want partners from across different lines to really help us address this issue and to ensure that Black mamas are able to live and have healthy pregnancies. We can go to the next slide. So again, this just kind of gives you a little bit of just what was happening with us, at the third committee, and this is what the report looked like. This is downloadable, so you can just Google this report, Reproductive Injustice, Racial and Gender Discrimination in U.S. Healthcare, and you can find that report and read it. It's a fantastic report, and we're extremely proud of it and the work that we put into it. But just to let you know that is downloadable. We can go to the next slide. So this gives you a little bit more about what the toolkit actually talks about. It's a toolkit for advancing the human right to safe and respectable maternal health care. In it, we talk about the human rights brief on maternal health, a summary of maternal health research. There's an overview of policy solutions proposed by multi-sector stakeholders, talking points, and other resources to help people use this as a tool to motivate and engage their communities. We can move forward. The structure of Black Mamas Matter, just to kind of give you all an idea of how we work, we are a Black women-led cross-sectoral alliance, and we center Black mamas to advocate, drive research, build power, and show culture for Black maternal health rights and justice. And so what you'll see here is that, Sister Song, as for now, we're anchoring this group, and we have the steering committee, which I am honored to be a member of. We have key strategic partners like the Center for Reproductive Rights. They're not a Black-led organization, obviously, but those folks who fall within this particular part of the structure are those who are helping us move policy solutions, think about ways that we can address this, across human rights and other ways, whether it's public policy or whatever it may be. And then we also have the members and the membership that we're building up. Next slide, please. Again, the overall vision for Black Mamas Matter is that we envision a world where Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. This is so important to us. I am a birth doula, and I am committed to birth justice work, and I believe that, this is something that we as birth workers have to be very diligent about because Black women are dying, unnecessarily. And for us, we know that there's many different factors that come into play with that, but we are working hard to bring all of those different pieces together to actually make sure that that's not something that remains a reality for Black women or any other community. We can move forward. So that's us. That's the Mother House, in case you all have never seen the Mother House. At least you can see a part of it. And these are the original folks that came together to help us really move this work forward. It's a dynamic group, fabulous people, and, yeah, the work is amazing. So you can find more information out about Black Mamas Matter at the website listed there, blackmamasmatter.org. And, yeah, we look forward to connecting with those who are interested in connecting with us. So we can move forward.
Okay, so we will go ahead and move into the discussion portion of our call. If any of you all have questions, we ask that you go ahead and put them in the chat box, and then I'm going to turn it over to Kara, who will be facilitating the questions.
Okay, so our first question comes from Priya Gupta, and she said that she does not have access to a microphone, so I'll read her question. Let's see. Priya was wondering if you could give a definition that you're using of women of color. Who is included in this group? She said, I've seen the definition vary depending on the environment in which the term is used. And then she offered a little more background, saying that Asian Americans are often excluded from the definition in some grant applications, which is dangerous because in an effort to address disparities in communities of color that are accepted as such, one might be contributing to new or exacerbating existing disparities in communities that are traditionally recognized as communities of color. And Priya said, I am so happy to see a focus on intersectionality, a critical component of serving communities of color.
Do you want to take Monica, or should I?
Well, no, I'll just say this first about Sister Song, and I would love to hear hear you as well, Lynn, of course.
Yeah.
So thanks for the question, Priya. I think it's an amazing question, and so glad that you're on the call. So Sister Song was founded by 16 organizations, right? And Sister Song was kind of like, this attempt to really do this cross-cultural, cross-racial organizing with different communities of color, women-led communities, women-led, of course. And so this organization was founded by indigenous Native women, African American women, Black women, Latinas, as well as Asian American women. And so all of those communities consider themselves the Women of Color collective that made up Sister Song. And so that's kind of the definition and, the history that we kind of move and organize our work around. You'll also hear Sister Song say indigenous women and women of color as a separate way of talking and not clumping Native indigenous women into the category of women of color, because that was something that was kind of teased out at the very beginning of Sister Song's creation around what felt good for how folks wanted to be identified and where they felt they landed, in terms of this country and, all of that. So it was a very intentional creation of this work and how we see these communities all contributing and being a part of that discussion. I would also like to give a resource. Our previous national coordinator, Loretta Ross, if you all YouTube Loretta Ross and women of color, like if you just put that in the thing, she has a beautiful definition and explanation of how she talks about women of color and how this definition came to be, which is definitely kind of like the root and foundation of Sister Song as well. So I'll let Lynn jump in on that, but I just wanted to kind of give a little bit more history as to how Sister Song.
No. Absolutely. And I wouldn't dismiss the idea that in practice sometimes particular communities are prioritized. So, Priya, I wasn't clear if that was coming through reproductive justice writings you were referring to, or just broader reproductive health, communications. But in particular communities, there may be an emphasis on a particular community of color and community of women of color or people of color based on what the local conditions are in terms of their health status or whatnot. But as Monica said, by design, the reproductive justice framework was designed to be very inclusive of the racial ethnic minority groups that collectively are a majority, if you will, in many parts of this country. And so it wasn't intended that some groups would be prioritized over others, but that each one of them would have a voice in determining what their needs are, and they would be the experts on the direction of, how we address their needs and correct injustices. So I hope that answers your question.
Yeah, and just to give another some more resources for folks, depending on your community and your culture. So there's a National Asian Pacific Women's Forum that definitely holds it down so beautifully for our Asian American sisters, as well as Forward Together, who was formerly Asian Communities for Reproductive Justice. And so they do a lot of this work, and we as a national collective look to these organizations for their expertise and their leadership in their communities, and helping us to develop strategies and ways to really bring everyone into the fold. So those are just some other resources of organizations specific to your question, Priya, about Asian communities and Asian American communities that I wanted to offer as well.
Excellent. Thank you for your response. We don't have any other questions on deck in the chat box, so if any of you joining online and via phone have a question, you can unmute yourself by pressing *7 on your keypad to ask your question.
Y'all don't have to be scared of us. You can ask us anything. Or maybe we just did so great, Lynn. I think they got everything.
Well, I would love to ask a question of Monica myself. We have just come off of a weekend of, organizing, marching on Washington, led by 3 women of color, dynamic women of color activists. And I know you were very much a part of several events. Are there any standout highlights you'd like to share, or where you see some of the next steps as we move forward from this powerful weekend?
Yeah, so there was a lot that went down. I have the privilege, it was definitely a privilege, to be in Washington, D.C., for a lot of the activities and things that were going on. And I think that what's sticking out the most for me right now is, there's 2 things. One, I'll start with just the march, right? I mean, the march itself was just a display of so much. I mean, I know I personally have never been a part of anything that large before in my life, and so to see that there is this national and international response that's led by women, and in the U.S. in particular, just women of color, was just a beautiful thing to see. And I think that, what this made very clear for the masses this weekend was that intersectionality is key. Like, there's no way that we can do this movement work siloed. Like, it doesn't benefit any of us. And this is something that reproductive justice, has been, saying and operating under for the past 22 years. And so for me, it's just like, yes to all of that. And it's the only way that we're going to see, justice. Is the only way that we're going to see the liberation for our people that we want to see. So that was beautiful, just amazing. And so I think that when thinking about what's next for us, what became really obvious, and I think it's something that we did not, I mean, I will say it did get lifted up pretty well, but it's something that, you know, visibly was clear, is that, you know, women of color and communities of color, we show up. We do. Like, and if we think about this political moment, politically, you know, we voted in the way that, you know, was going to make sure that we had at least the best that we could possibly have, right? And unfortunately, that did not work because the work on, you know, the other side wasn't put in. Like, there's so much emphasis on making sure that communities of color vote and they get access, but the work on, you know, having white folks talk to their people too wasn't something that happened. And now we have Trump as president. And so I'm not trying to put, you know, a lot of weight on someone, but when we think about what happens after this moment, our strategies have to shift, right? And we have to really think about what that means for us. That was a big thing that came up for me. And the last thing I'll say really quickly is that, you know, I had an opportunity to also perform, right, because I am a singer and I'm an artist. And I really am excited about this culture shift movement that's happening right now that I'm proud to be a part of, where we are, like, making sure that artists are not just seen as folks to come and sing at an event or say a poem or create a pretty picture for us, but that they have expertise that's necessary in this moment. Like, I do believe that artists are like the heartbeat of movements, and every movement in history has been transformed by artists. And so we have to put more emphasis on that. I just saw that, you know, President Trump is like, you know, oh, God, that just made me sick to my stomach when I said that. But this man, you know, is now withdrawing money from the arts, right? Because, you know, he doesn't like freedom of speech in any kind of way, but our artists are like the mouthpieces, and they're the voices and the bodies and the, you know, they create, you know, the very real art that's necessary for this moment. Nina Simone says the duty of an artist is to reflect the times, right? So I was excited to be able to couple my artistry and my activism together this weekend, and I think that moving forward, we have to think about who's at our leadership tables, how are we opening the table up for some unlikely suspects to actually add expertise, and how are we thinking about shifting our strategies that's going to help us get to a place where, you know, our most marginalized communities are centered, where we're thinking about them, and we don't have a repeat of what just happened in this last election. That's what was coming up for me.
Thank you very much. We have a few more questions in the chat box. The first one is from Barbara. Barbara, are you able to unmute yourself by pressing *7? Okay, I will read Barbara's question. Barbara says, I am a nurse that works with mothers who have had adverse outcomes such as miscarriage, stillbirth, newborn death, and SIDS. What type of resources do you have in place for those that have experienced a loss so subsequent pregnancies do not have adverse outcomes?
Well, in terms of resources, I mean, Monica has shared what's available in terms of learning the, you know, what's been discovered in terms of the disparities and the health outcomes through the Black Mamas Matter project. I think from a service model, we're familiar with just how many adverse health outcomes happen for women of color. I think wherever you are, it's finding out where are the resources in your community, and who are the women of color and other groups, other social justice organizations that are supporting, families, low-income families, and folks who are the most marginalized. Some of the work we're doing in New York City is to identify who has reach into the communities to provide the support, because sometimes those are the least resourced organizations, but they're doing the most significant and powerful work on those limited resources. And when you build networks for those organizations to share among themselves and to mobilize, you can both change the structural conditions, at the same time find out what the needs are that can redirect resources to those, not only those individuals, but those communities. And that is less on the individual level, perhaps, because you have to think about it in terms of, the life course of the individual and their whole family, but it also is what's going on in that community that's making it hard. One thing that we're really having to grapple with when we look at these really horrendous, poor infant and maternal health outcomes is that this doesn't happen overnight. This has happened over generations. This has happened, in an entire community. So the policies that will need to change are quite wide. So even institutionally, if we think it's only happening in the healthcare environment, it's not. It's happening in the housing environment. It's happening in economic policies. It's happening in, what are the employment opportunities, what's happening around education in the schools. And that can seem overwhelming, but that's what it requires to really address the root causes of reproductive oppression.
Thank you. Our next question comes from Charlotte. Charlotte says, how do you build out policy work to get leadership buy-in into the reproductive justice work? I'm working at a local health organization with diverse leadership. Some totally get the reproductive justice framework, some do not. How do we bring leadership, especially white, well-intentioned leadership, into the reproductive justice work for citywide family planning efforts?
This is Monica. I think that's a great question, Charlotte. Our allies are very crucial and very important to the work of reproductive justice. What's interesting about the reproductive justice, framework and movement was, it's a culture shift movement. It definitely is about shifting the power dynamics that have normally been the norm, in these larger movements of reproductive health and rights, and even when we think about, health in general, right? Like who's been leading this work. And so this movement is very much about shifting that and centering the leadership of people of color and making that shift. But that's not to say that, the support and the leadership of allies is also not crucial in that endeavor. And I think that education is the first thing. And so, as much as it's possible for, folks on your team and as much as you can help to infuse within your team these concepts of reproductive justice, whether it's, raising up an issue that's happening in the media or whatever, and talking with your team about where's reproductive oppression in this? How is this reproductive oppression? How is this an injustice? Allowing people to really start to connect to the issues and, when possible, see themselves reflected, and when not, allowing themselves to analyze and make clear to themselves about the ways in which their privilege affords them, this privilege of not being, in that situation, right? The more that we can get those conversations going, the more that people have the opportunity to have those conversations, then we start to see the shift happen, and we start to see allies showing up in true allyship, and we see, those power dynamics start to shift in the ways that they need to, so that, our work is really lifting and amplifying, and again, shifting those norms that have just been placed on us for far too long. So I think education is the biggest thing, and the more that you can create those opportunities for folks to see themselves reflected, and then have those conversations about what that means to them, I think that's the way that you start to get to true allyship, and you start to get to the place where you can start to shift those power dynamics, and hopefully start to see the policies follow with that.
Thank you very much. Rochelle asks, she says she's on the Black Mamas Matter website, and the research overview of maternal mortality and morbidity in the U.S. is not available. Is there another way that we can access that publication?
I will actually send a note up for that because I'm not sure why that link would not be available. I do know that the website was under construction as it was being built for a second, but I think that everything should be live. What I can make a point to do, if I can, the leadership team here that helped us with this particular webinar, if for some reason that link does not get fixed relatively soon, I can send that over as a resource, and that's something that you all could potentially send out to this list. Would that be helpful?
Sure, we can do that.
Perfect.
Okay, the next question comes from Hannah. Hannah says, I'm an American Indian and Alaskan Native ally about to start an MPH-DNP program specializing in maternal child health. What are some things that I can do during my graduate training to gain the skills to be a leader and stay involved in reproductive justice during my studies?
Well, there's one great thing that's coming up in October. So we have our National Let's Talk About Sex Conference, which is the largest reproductive justice conference of the movement. And so that's coming up in October. So I think the more that you can stay connected to Sister Song's work, we would love for you to stay connected to our work, but we, as a national collective, we really do try to create the spaces for folks to learn more about the framework and to be more involved in it, so that's definitely one thing. I would say, depending on where you are, like, I'm not sure if I heard where they're going to be based. Are they based in Alaska, or are they going to be based somewhere in the U.S.? Was that clear in the question?
She did not say. Let's see if Hannah, could you answer that? She says in New York.
Oh, great. So there's awesome RJ representation in New York. National Latina Institute for Reproductive Health has an office there. There are many activists who are still very, very, very active, doing work there. So I just think that there's great spaces to be connected to there. There's Ancient Song Doula Services that's there. They do a lot of birth justice work. So, there's local or state-based, I could say, but definitely state-based and local organizations that she should definitely stay connected to as well. And, what we try to do is amplify the work of all the organizations doing the work across the country. So if you're not on our listserv at Sister Song, you should definitely sign up for that because that will absolutely keep you in the know as well. I hope that's helpful.
Thank you very much. Okay, and this question comes from Kiko. She says, can the speakers give some examples of how one might transform institutional policies and practices that impede reproductive justice?
Well, some examples, again, I think come from how you engage with communities. And so a large part of the work is the listening. So listening to the communities, however you shape that process. Once you have gathered that information, how the internal leadership uses that to both assess what their existing policies are that perhaps, community members have found problematic. It's up to the institutional leadership to then create the opportunities for those policies to be re-examined and tweaked accordingly. And again, policy is a big issue. Sometimes it's, how resources are allocated, how you give out funding. Sometimes it's, what are the organizations that you bring to the table to guide the work. And it can be, minutia policies, internal policies around, hiring and how you offer opportunities for leadership internally. Does your organization reflect the communities that you serve? And in an intersectional way, right? Sometimes it's not even enough to have, people of color who reflect the community, but you have to have the intersections of class and sexual orientation and gender as well. And I think having the continual conversations, you have to do some real serious work about how people understand intersectionality, how they understand racism and sexism and gender oppression. And those things have to happen, coincide with doing the actual work. And sometimes it's not enough to just have the education and the training. Leadership has to be developed. So leadership around reproductive justice has to be developed within institutions so that it has staying power, so that the folks who go out and get educated and trained, it doesn't just sit with them, that it sits within the institution. And that we're still in the early phases of doing that. And it's going to be, ongoing and continuing. You have to be willing to mess up, make mistakes, and then correct them because you've had people there to hold you accountable when you do, and to build up the trust that folks are willing to still work with you despite those missteps along the way.
Thank you. We have
and I don't know if Monica, you wanted to add anything to that, because I consider this just very, ongoing, continual work of just, having really good dialogue with folks to do these cultural shifts and institutional shifts.
And no, I think you're right, Lynn. I think that you hit it right.
Great. We have one last question. Darlene wants to know, Monica, if you could share when the conference is that you mentioned, and she's also curious what reproductive justice organizations are in Texas.
Yes, absolutely. So the conference is going to be October 5th through the 8th. That's Thursday through Sunday, October 5th through the 8th. It's going to be held in New Orleans, which is very exciting for us because we have great partners there. And the registration is going to be opening up the first week in February, so you all get to get in on that very soon. The early bird will be opening up, as well as call for proposals. So extremely exciting times ahead of us. And in Texas, there's quite a few. So the AFIA Center is the director there. Her name is Marsha Jones. They do amazing work. The National Latina Institute for Reproductive Health also has an office there that does a lot of work on the border states. And, yeah, they do amazing work. So those are the two main organizations that we, in terms of reproductive justice organizations that we do work with. We do work with some affiliates there, from Planned Parenthood to NARAL to other mainstream kind of repro health organizations. But in terms of repro justice work, those are the two main groups that are leading the work there.
Excellent. Thank you so much. And I also just want to take this moment to plug our CItyMatCH conference, which will be September 18th through the 20th in Nashville. And we are accepting abstracts now. They are open through March 1st. And we would love to see some of you submit abstracts around reproductive justice. All right. Thank you for an excellent Q&A session. So I'll hand it over to Reagan for closing.
All right, so thank you everyone for attending today's webinar on reproductive justice. The webinar recording and slides will be posted on our CityMatch website, so please feel free to share this information with others that were interested in attending the webinar but could not attend. Following this webinar, you will all receive a post-webinar email from ReadyTalk. It will contain a link for a webinar survey. If you could just take a brief moment to fill out this brief survey, the SurveyMonkey link will be included in that ReadyTalk post-webinar email. If you enjoyed this webinar and would like a chance to continue the discussion on this emerging public health topic, please consider joining the Reproductive Justice AdHoc group. Our next call will take place in February, And on this call, we will be having a follow-up, in-depth discussion of the components of reproductive justice that were presented on this webinar. So if you'd like more information about this group or you would like to be added to the listserv for this group, you can go ahead and shoot me an email. My email address is up there on the slide. And lastly, Kara and I would like to extend a sincere thank you to our speakers, Monica and Dr. Lynn Roberts, for their wonderful presentation, and also thank our board members, Kiko and Deb, for all their help in planning this webinar. Thank you.
Thanks, everyone.
Thank you for having us.